Utility of texture color enhancement and red dichromatic imaging during endoscopic resection. These are the disclosures. Dr. Hassan, Dr. Dragunov, and Dr. Yang are consultants for Olympus. All other authors have nothing to disclose. The quality of endoscopy has remarkably improved by the introduction of digital image-enhanced endoscopy on novel integrated video processor platforms. In this video, we will specifically discuss the use of two digital enhancement technologies, texture and color enhancement imaging and red dichromatic imaging during advanced endoscopic resection. With the integrated interface of the novel video processor system, these imaging functions can be readily accessed on the touchscreen display or programmed as a function on the buttons of the endoscope. Texture and color enhancement imaging is designed to enhance three image factors during white light examination: color, texture, and brightness, with the goal to help better define subtle tissue differences during endoscopy. Here's an image of a sessile serrated lesion in the cecum. With texture and color enhancement imaging, the input image from the video processor is split into a base layer and a detail layer. The base layer is then adjusted for brightness, followed by dynamic range compression or tone mapping. Following that, texture color enhancement is applied to the detail layer to enhance subtle contrast. The two layers are then merged, resulting in an enhanced post-processing image. In this case, the enhanced image provides more detailed information about the lesion margins and surface pattern, which is particularly more evident on a side-to-side comparison with the original white light image. In the following section, we demonstrate the use of this technology to enhance optical assessment and lesion characterization. The first case is that of a cecal laterally spreading non-granular lesion. Under white light, you can appreciate a subtle area of depression. Once the texture and color enhancement feature is turned on, it allows for a more detailed view of the lesion's surface pattern, highlighting subtle differences that may have been subdued under white light examination. The stark contrast and level of increased detail is more apparent when we look at the real-time video of this lesion. Comparing side by side to the white light input, the enhanced image facilitates the recognition of an area concerning for submucosal invasion. This led to the decision to perform endoscopic submucosal dissection as opposed to mucosal resection. The final pathology was consistent with superficial adenocarcinoma without high-risk features. Here we have another side-by-side comparison of a frond-like villous bulky lesion. With white light, lesion examination is somewhat limited by the overlying mucus film over the surface of the polyp. In contrast, the use of texture and color enhancement technology helps overcome these issues, allowing for more detailed visualization of the lesion's surface vascular pattern. In the following segment, we demonstrate the utility of texture and color enhancement imaging for identification of structures during endoscopic resection. Here's an example on the use of texture enhancement imaging during endoscopic mucosal resection of a duodenal polyp. The digitally enhanced image improves the delineation of all structures, including the lifted submucosal space and blood vessels. Importantly, the stark contrast of the normal mucosa and adenomatous tissue aids in the accurate placement of the snare during piecemeal resection. In this video of ESD of a colonic lesion, we see a side-by-side comparison between white light and texture and color enhanced imaging. The added contrast and texture enhancement improved the distinction between submucosal fibers, intervening vasculature, and muscle fibers, facilitating a more precise dissection. Red dichromatic imaging is another form of image-enhanced endoscopy that enables the observation of deeper tissue regions by utilizing lights of longer wavelengths. The objective is to enhance the detection of bleeding points and deeper blood vessels. The video processor light source unit consists mainly of 5 light-emitting diodes or LEDs, namely violet, blue, green, amber, and red. All 5 LEDs emit light during a white light imaging observation. Because red dichromatic imaging uses 3 narrowband lights of longer wavelengths, only 3 LEDs, green, amber, and red, emit light during observation. After the 3 LED lights are combined by dichroic filters, the spectrum of the combined light can be narrowed by the red dichromatic imaging filter and is then inserted onto the optical axis. With this type of image enhancement, red light penetrates deeper into the tissue than green light. If a blood vessel is present or the blood concentration is very high, as in the setting of active bleeding, the amber light is strongly absorbed, which results in the target area appearing darker than its surroundings. In the following videos, we will demonstrate the use of red dichromatic imaging during endoscopic hemostasis. In this video of endoscopic submucosal tunneling during gastric peroral endoscopic myotomy, we can see how the use of this image enhancement facilitates the recognition of submucosal vessels. This allows for targeted preemptive coagulation and thereby reduces the risk of intraprocedural bleeding. In this video of brisk bleeding during ESD of a cecal polyp, we can appreciate how the dichromatic imaging mode enhances the identification of the bleeding point and allows for more targeted and precise hemostasis. By using lights of longer wavelength, red dichromatic image can penetrate biological tissues under the thin blood layer. This in turn creates a see-through effect and reduces the background noise of surrounding blood, and therefore enhances the detection of target vessels for hemostasis. In conclusion, image-enhanced endoscopy may improve differentiation of subtle tissue differences and improve visualization of structures, which can assist during lesion characterization, endoscopic resection, and hemostasis. There are some potential drawbacks with these technologies, including changes in image characteristics, which has a learning curve to it. Additional studies are needed to further corroborate the application of these imaging modalities in various endoscopic applications.